mentioned implants and that being able to stand by your word when you're placing an implant. One of the emerging technologies is Blast. How does Blast really work for implants, and how does that enable kind of that short-term impact and the long-term impact of Blast for your patients?
Blast is another one of those protocols that is, just in application and philosophically so interesting and so cool, and it makes sense. Again, before you go into any procedure, any surgery, the first thing you do is you wash your hands, right? It's the first thing you do. First step to successful surgery, even though we wear gloves, is to wash your hands. Make sure your hands are clean. The Blast protocol involves the application of that very same philosophy, where the implant site is prepared using a laser in such a way that it is pretty much sterile, able to receive an implant for great integration, right? We know that
when we're talking about sterile, I think you're also talking about the Rams and Macaulay research about the decontamination that happens within the nap, but then also how that applies out to implant preparation. So those
Correct.
biological principles kind of come into play all the way full circle.
Correct. It ties into what we were saying before about setting up your children, for instance, for the best opportunity for success. It's these tweaks, it's these little optimizations and calibrations that we make that really make the difference between, you and somebody else. The concept of having stored energy in the body and the biostimulation of the laser, in addition to the integration of the implant in the implant site, is just like, who else does that? It's literally an application for every phase of every outcome. If they're going to keep their teeth, you have Linap. If they're going to place an implant, you have the Blast protocol. If you're trying to maintain an implant or save an implant, you have Lapin. It's just every step of the way, everything has been accounted for as far as how you can take care of your patient in the best possible way.